What is going on now? It seems that public health is literally flipping from one side to the next with regards to COVID 19. That suggests they're not sure what's going on. The reality is that I'm not surprised because I don't think that they understand the disease. I don't think many people do. And this is what's causing the problem. When you understand what you're dealing with, you can then make good decisions. And so, what we have here is a situation where we can see that in January 2023, there was clear guidance from the UK Health Security Agency on pregnancy and breastfeeding. The COVID 19 vaccine is strongly recommended for pregnant women and breastfeeding women by the Royal College of Obstetricians and Gynecologists. The vaccines are available in the UK, are the safest and most effective way to protect you and your baby. It's remarkable. It's great. And so this was just about a year ago, and this was the recommendation. And so pregnant women would go out and they'd get vaccinated, and they'd say, "Wonderful, I'm protected." And again, as I said, if you understand the science, you will know where there are flaws in what is happening. I have to be careful now because I have such a good understanding of the science that sometimes what I say may come across as misinformation. And believe me, there are people who are watching for me to make any kind of opportunity to silence what I'm talking about. And so, just a reminder before I go any further that I want you to join me on the journey of learning about how COVID can be used to help understand any viral disease. That's what we've written here with Prepared Against Disease X. In reality, I've used all of the understanding and knowledge about COVID to discuss this. And when we talk about pandemic preparedness, you'll understand why disease X is just another version of what we're seeing now. And if you go to the landing page in the description, one, you can sign up to get the pre-order wait list. Excited to tell you that the it's now available as a pre-order on Amazon. And even if you didn't want to do that, you can still get the preview of Disease X. I am so sure that you are going to enjoy reading this that I have put out the free preview with just a few chapters just so that you understand the way how it's written, the uncomfortable truth. It's a narrative story to take you through what happened in the pandemic and to help you understand what's going on. So take a look at it and really tell us what you think. But let's get back to the issue here. In January 2023, as I said, the recommendation was for COVID vaccines to be pregnant and breastfeeding women. This was 10th of January 2023. So the question is, why am I talking about this now? What happened different? Well, let's see what the most recent decision was just about little over a year and a half down the line, almost 2 years. So now we are November 2024. So this is the JCVI statement, and they are in charge of making the decisions about vaccination. And so they're giving a summary, and they're talking about over the last 4 years, population immunity to SARS-CoV-2 has been increasing. Interesting. And then there is, as usual, the combination of natural acquired immunity following recovery. They've recognized that from infection and vaccine derived immunity. This combination is termed hybrid immunity. Just to let you know, just be careful with this word, but I'll not say anything else. Now, this is the bit that gets me worried. COVID 19 is now a relatively mild disease for most people, though it can still be unpleasant. Okay? Hold fire on this thought here. Let me just explain something to you. Just because a disease is mild doesn't mean that the pathology is mild. I keep on using the example of HIV. If you got HIV, God forbid you don't, but if you did, within 4 weeks you have some mild flu like symptoms. Does that mean HIV is mild? No. So, in the same way, if you understand anything about autoimmunity and the autoimmune response and immune priming, any recurring infection with this virus, even if it appears mild, is not mild. This is why I'm so worried, and I've always been talking about the COVID storm. But let's get back to the scientific discourse here. So went on. With rates of hospitalization and death from COVID 19 having significantly reduced since SARS-CoV-2 emerged. Now, this bit here is very important. When they say rates of hospitalization and deaths from COVID 19, again, let me just inform you they are talking about respiratory disease. So when you get severe COVID 19 and your lungs are having the cytokine storm and people can't breathe and they end up on intensive care, that's not happening. Now, remember, hospitalization is at the highest it has ever been. What they are assuming is that it's not related to COVID. As I said, excess deaths are up. If the same number of people were dying, but just not dying of respiratory disease, would you be bothered? That's effectively where we are, where people are still dying, they're just not dying in the same way. And so that's part of the problem. If you understand the disease, you will realize that you have to look at all cause mortality, not respiratory mortality, because it will not present in the same way because everybody has been exposed to the virus. That's just the way the science goes. Anyway, getting back to what they said here age has always been strongly associated with the risk of hospitalization and mortality, with the oldest population in being the most vulnerable. You know, this was so obvious at the beginning. This is part of the reason why I'd always said targeted vaccination. We knew who was at risk. We knew their characteristics: age, specific comorbidities, obesity. That was it. To really target down, hammer down. There was a small cohort that appeared to not have any issues. And even then, they had interferon autoantibodies. We could have figured out who they were. But no, we had to go and just blanket bomb the place. Anyway, let's move on. So now they're saying that COVID-19 has become an endemic disease with a move towards standard assessments of cost effectiveness. So this is now the point. And the focus of the program is shifting towards targeted vaccination of the oldest adults and individuals who are immune suppressed. Remember this word targeted vaccination. This is exactly what they should have done at the beginning of the pandemic. Targeted vaccination. I will challenge anybody on that. There is no logical, scientific, good reason to go beyond that targeted group. They made a mess with it and they don't want to acknowledge it. So they're now pretending that, whoa, we're up to date with the science and we are adjusting stuff because it's relevant. So that's their basis. And before I get to exactly what they said about pregnancy, let's look at where the numbers are. And I'll make this thing here bigger so that you can see it. And so they were looking at respiratory tests for weekly percentages of positive tests for influenza, SARS-CoV-2, RSV, and rhinovirus between October 2023 and 2024, so 1 year. And you can see here that rhinovirus is light blue, SARS-CoV-2 is maroon, influenza is green, and RSV, respiratory syncytial virus, is dark blue. RSV was high in November 2023, went down and stayed down. Interestingly, we had a surge of influenza in February 24, went down, it stayed down. But look at SARS-CoV-2. SARS-CoV-2, again, peaked here December 2023. But look at this. This is summer of 2024. It had the higher peak. This is an absolute red flag that we are going to see a winter of discontent. And then alongside it, which I have to think about, is rhinovirus. Why in the world, in the summer period, is rhinovirus, a simple cold virus almost, this high? To me, this suggests interferon suppression and that people are unable to deal with viral infections properly. And so, rhinovirus is very strange for it to be consistently high, especially in the summer period. Something is not right. It's surging again now. So, I'll have to follow this one here. The combination of these two seems to be an issue, and I'm not quite sure what's going on with them. But the point I'm making is that the fact that the disease is mild in terms of respiratory presentation doesn't mean that we don't have a problem. And again, as I said, they're only focused on ITU and HDU. And you can see here, this is all that they're looking at. In October 2020, you see the peak here. This is what they're worried about, intensive care spots being filled. And they can see it went down in January and it's gradually going down. This pattern is all about how the immune system responds to the virus after the combination of either natural immunity and hybrid immunity. So they are correct in that sense that we are not going to see this kind of surge, I don't think, again, because the virus is no longer novel. However, just because this is down doesn't mean that people are dying. People are still dying, excess deaths are still up, there is a problem. And so we have to realize that we have to look beyond just the simple information. So let's come now to what they said about pregnancy. And in case you missed it, this was my question here. Why? What in the world has happened in terms of pregnancy? What has changed? So, as we get to it here, during the COVID pandemic, pregnant individuals were offered vaccination to reduce their risk of hospitalization and mortality from COVID 19. Recent data, however, indicates that the risk of hospitalization and or mortality in pregnant individuals has significantly reduced in the Omicron period. I, I tell you, anybody could have told you that. It didn't take 2 years to figure that out. Omicron is like a different beast. And this is what they said. The point was the peak in COVID hospitalizations in currently or recently pregnant people was during the Delta variant wave. Absolutely. Omicron is a different beast. And it's not that Omicron is necessarily so mild. So, this is why I said you have to understand the science. Omicron targets different things. Omicron targets the sinuses and the upper respiratory tract. And so, this is why it will give you the bronchitis, and you'll have other associated infections along with an Omicron infection in the chest. In the heart, Omicron actually targets the heart better than any of the other variants. So you're more likely to get inflammation in the heart with an Omicron infection. And additionally, Omicron, because of the proximity of the sinuses to the brain, because it targets the sinuses, you're going to see neurological issues increasing. Different variant, different presentation. So if you are not looking for the change, you will not notice it. This is part of the problem. So let's get back to what they said. In reviewing the cost effectiveness of COVID vaccination in pregnancy, taking into account the potential health benefits in the pregnant person and the neonate, including a neonatal death, JCVI advised that it is highly unlikely that vaccination in pregnancy would be cost effective. So, in effect, it's no longer recommended in the UK. Now, this may be different in other countries, And part of the problem, maybe they would have been different if they still had the AstraZeneca vaccine, which was UK produced, but that has been pulled off the market. So now they'd have to buy Pfizer or Moderna. It's not their vaccine. They have to pay premium for it. So suddenly the cost effectiveness is not so good. No, because it's made in the US, you may find that the US has it maybe at a cheaper rate, or maybe they aren't bothered. And so, therefore, the CDC may be recommending it differently. This is where the confusion comes in. And this is where they are messing up the public understanding as to what's going on. There is no consistency of message. It feels as though nobody quite knows what's going on. It's just a hit and miss. And then the public starts to think, well, I wonder if this was the approach they took to all other vaccines. That's why hesitancy is increasing, and they need to address it. And the only way to address it is to first acknowledge that they probably really don't know what's going on. This is kind of like what Gert was saying, is, they just don't know what's happening. They don't know how to predict what's happening next. And because they're guessing, nothing is working the way they wanted it to. We're in a mess here now. And what I think is that when I think about pregnancy, even, all I would say is that in pregnancy, I'm not sure if that's necessarily the correct decision across the board. What they should have done is, in the same way that they targeted the elderly and people who are immune suppressed, well, that could be a different argument for the immune suppressed. But the people who are at highest risk with regards to COVID at any point were older pregnancies, obesity, where significant obesity in pregnancy, and the comorbidities, the diabetes, the hypertension in pregnancy. These were the conditions that were high risk in Delta. And there is a real possibility that they could still be high risk, higher risk, even with Omicron. And so they could have taken the position that targeted to that specific cohort who they already identify as high risk pregnancies. That's the bit that is failing. There's no clear science here. There's no logic. There's just yes or no, black or white. In medicine, it doesn't work like that. And this is the point in terms of when people talk about the vaccine. I am very nuanced. I have a good understanding as to who would benefit. I have a good understanding who won't. And it's about trying to understand that risk benefit for each individual is how we should have been practicing. This blanket approach, either yes or no, is going to lead us down a very serious road. And so, in conclusion, as I talk about the final thing, I'm going to show you this chart again, and I'm going to come back to it. This is where SARS-CoV-2 is, September into October. You guarantee that going into winter, it's likely to peak further. As you can see here, in October and December 2023, it peaked. I expect it to rise higher. That's just the trajectory of the disease. But the problem is the presentation of disease is not going to be as expected. And that's the problem. If you don't understand that, you will not recognize when it's happening. It will be a surge in hospitalization, surge in mortality from multiple causes, because the virus operates in different ways in different people. There are some challenging times ahead, and sadly, I don't see any easy way out because there hasn't been enough of a focus on understanding the basics of the science. So, as I said, if you want to understand the basics of the science, please join us in this journey. Are you prepared against Disease X? And join us. You can get a preview of Disease X right here if you click on the link and sign up, because the pre-order on Amazon is now available as well. So please join us in this journey. Your support is valuable to us, and I'll continue to share as much as I can about the science whilst they let me. Have a good evening.